Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zia Khwaja. I welcome all of you from the MMK Hub for today's lecture of parathyroid pathology. Parathyroid pathology is an important topic regarding theoretical, practical, and clinical aspects. It's the topic for which undergraduate and postgraduate medical students usually don't have clear concepts. So our aim is to clear your concepts and make the subject as simple as possible for you. This is very important that what are the biochemical findings in hyperparathyroidism. When a patient report to you, first of all, you have to advise serum calcium level and serum parathormone levels. In hyperparathyroidism, with increased serum calcium, there is increased parathyroid hormone and decreased serum phosphate and increase in the alkaline phosphatase. While in other causes of hypercalcemia, due to the negative feedback, there is decrease in the parathyroid hormone. But in hyperparathyroidism, with the increased parathyroid hormone level, the calcium level is also increased. We can compare the various types of hyperparathyroidism, primary, secondary, and tertiary. We will discuss these types shortly in the next few slides. On the basis of the biochemical parameters, we can differentiate between these three types. You can see in primary hyperparathyroidism, there is increase in the serum calcium. The serum parathormone level may be increased or it may be normal, while the serum vitamin D level is increased and serum phosphate level is decreased. In secondary hyperparathyroidism, the serum calcium level is decreased and parathyroid hormone level is increased. While in the tertiary hyperparathyroidism, the parathyroid hormone level is much increased as compared to the primary and secondary cases, with the increase in the serum calcium and increase in the serum phosphate. This we will discuss in the next few slides and you will have a much clear concept about it. As far as the pathology in the other organs is concerned, we have discussed previously the osteitis fibrosa cystica. It is a bony lesion which occurs due to the bone resorption by the osteoclast activity, with the fibrosis and cyst formation and the hemorrhage in the bone. And this is typical of the hyperparathyroidism. Similarly, there can be a collection of osteoclasts in the bone, which forms the brown tumors. It is also a typical feature of the hyperparathyroidism. At the same time, there can be chondrocalcinosis and pseudodrive. In renal system, calcium stones and nephrocalcinosis can be present, and there can be metastatic calcification in other organs. For example, the blood vessels, myocardium, stomach, and lungs. This is all about the primary hyperparathyroidism. Now the secondary hyperparathyroidism. In secondary hyperparathyroidism, renal failure almost always present. Phosphates build up in the blood and causes the calcium to drop. Phosphate itself can cause the release of the parathyroid hormone. So in secondary hyperparathyroidism, there is decrease in the serum calcium, but parathyroid hormone level is increased. And that increase in the parathyroid hormone level can be due to the phosphate levels, decrease in the phosphate levels. Glands begin to function autonomously. Secondary hyperparathyroidism. It occurs in any condition associated with chronic hypocalcemia, mostly the chronic renal failure. Glands are hyperplastic, and renal failure lead to decrease in the phosphate excretion and increase in the serum phosphate level, which causes the increased parathyroid hormone levels. Now, what is the tertiary hyperparathyroidism? It occurs in the long-standing cases of renal failure, which can occur post-procedure of the renal transplant cases. There is autonomous parathyroid gland function. That parathyroid gland is not under the control of the calcium levels and serum calcium regulatory levels. It can cause problems similar to the primary hyperparathyroidism, and usually the operative intervention is needed for the symptomatic disease, or there is the autonomous parathyroid hormone secretion persist for more than 1 year after a successful transplant, or there is subtotal and total parathyroidectomy with autotransplantation. In these cases, we have to go for the operative intervention. In tertiary hyperparathyroidism, the calcium level is increased, but the parathyroid hormone level is increased out of proportion due to the autonomous activity of the parathyroid gland, that it is not in concurrence with the calcium levels. Very much. If you have any query, you can contact us on our website or a WhatsApp group for any question.